Hello, everyone. This is Dr. Suchismita, welcoming you all to yet another episode of Mathematics of Diseases, where we explore the physics and the metaphysics of diseases with our co-host and a very dear friend, Jana Reddy, who is a certified international healer and coach. Hi, Jana. Welcome to the second episode.
Thank you, Suchi. And just to add a couple of lines to the viewers, uh, we are not trying to dispense the current treatment that you are going through or taking through as such. We'd like to add more value to understand the physics behind it and also what are the probable reasons, because when I talk about certain case studies, it may differ from person to person. So please take these inputs, what we're sharing, and then you apply what is the most relevant a treatment methodology that you'd like to use it for your own self. Of course, you could send us direct messages. We can definitely share more information. I can guide you in the right manner. What approach would be then appropriate methodology for you to come out of this particular problem that we chosen this time, because one of the a very common symptom that we call about, people do complain and they keep coming to us and saying that we have an IBS issue, so we had to pick up this particular symptom or a disease or a discomfort in the body and discuss more about this. And now it's over to you, Dr. Suchi. So please share more information about the IBS and let us go deeper into this.
So, like Jana mentioned, in today's episode, we will be discussing the irritable bowel syndrome known as the IBS. Well, did you all know that IBS is related to the brain and not the mind? Have you all heard of the term brain-gut connection or the brain-gut axis? What exactly is this connection called the brain-gut connection? I mean, has anybody heard of this term? Well, let me explain it out to you. So basically here, the brain sends signals to the digestive tract via the parasympathetic nervous system and the sympathetic nervous system. So the balance of signals between these two inputs can affect the speed at which the food moves through the gut, and then the absorption of nutrients, secretion of digestive juices, and also the levels of inflammation in the digestive system. So, and we all know that the digestive system has a nervous system of its own called the enteric nervous system. And this also receives inputs from the sympathetic and the parasympathetic nervous system, but it can also function independently. The enteric nervous system is intimately interconnected with millions of immune cells that survey the entire digestive tract, and they convey information such as whether the stomach is bloated, or if there is infection in the gut, or if there is a backflow happening in the gut. Because basically, if there is insufficient blood flow, it immediately notifies the brain. So you see, this is a two-way traffic. So the brain and the GI system communicate with each other in both the directions. And because of the strong gut connection, brain-gut connection rather, the stress and variety of negative emotions such as anxiety, sadness, any confusion, or any negative emotion, I would say, can affect your GI system. Now that we know that emotions affect the gut, let's just hear a little more about it from Jana.
So when we talk about the brain-gut connection, so there's a micro brain which is there in the gut too. So now there is a big signal, we have a big brain which is controlling your entire, your hormones, your gland, which is controlling everything. And this is also sending out a signal to the micro brain, to process certain amount of emotion that comes in as such. So it's very important, apart from the food types that we consume, it's also important the emotions, with respect to the situation or upbringing, or with respect to how we've been brought up from the childhood too. And also it has an impact. I'll discuss more when I talk about the case study. So where you'll be able to understand and interpret it, how a person's and childhood evolution, how it has an impact on the life, and not only as per the life, it's also has an impact on the IBS condition too. So it's quite interesting when we look at, especially mainly the stress and anxiety is a very important factor, which you need to consider to be able to handle it. The mental health part of it, the stress and anxiety is a very important aspect. And this has got a huge impact on the IBS. And then sometimes, we carry it out for years together and we struggle with this. and we are coping up with it, with sometimes we see people, carrying laxatives. We are trying to consume certain amount of fluids and try to keep it, and they still say, nothing is working for us. So now we are going to give a little extra information about it, what can make it work. So that's what is going to be very interesting in this episode. Over to Suchi. Let us hear about the statistics and other information.
Okay, so before the statistics, I'd like to discuss the causes. So basically, if there is muscle contraction in the intestine, irregular muscle contraction, or if there is abnormality in the nervous system of your digestive system, or severe infection, or if there has been stress in your early life, or if there is change in the gut microbe, triggers such as food, stress, risk factors include if you're young and below the age of 50, sometimes it's even seen in children these days, family history, and if there is an already existing mental health disorder like anxiety, depression, they could further worsen your IBS. Complications, there will be poor quality of life, there'll be mood disorders. So basically, it'll just disrupt your normal life. Like, it's just a it's your gut that's causing so many issues and it troubles you out completely. So, yeah. So, what are the body symptoms? Abdominal pains, cramps, bloating, change in your bowel movements suddenly, could be either constipation or diarrhea, or alternating between the two, could be diarrhea, constipation, or again diarrhea. So that pattern is also possible. And then excessive passage of gas, and then mucus in the stools. And also, few women report of IBS flaring up during the menstrual cycles every month. So what are the statistics? IBS affects 5 to 10% of the population worldwide. And while it is 10 to 15% of the adults that suffer from it, only 5 to 7% have been diagnosed till now. It is mostly seen in people under the age of 50. But also, like I mentioned earlier, it's seen in children too. So what is our current management or treatment? We basically ask them to consume a lot of fiber. Laxatives are given, probiotics, and then antidiarrheal medications, anticholinergics. We sometimes prescribe tricyclic antidepressants and pain medications. So this is basically, there's no fixed treatment depending on the symptoms. It's basically a symptomatic management. So let's just hear a little more about the metaphysics about it from Jana.
So when it comes to the metaphysics of this particular disease, what are the causes that can have an impact on a person's gut health? Like, there are certain case studies that I have. I want to predominantly talk about one particular case study wherein a client was going through the IBS problems since a long time, and it had a lot of impact on the person's movement in life. It could be traveling, because this person had chosen a job of marketing and then he had to travel. Even though there is a similarity in a way, we know that most of the women are affected with the IBS. I have got a case study which I'm going to discuss about a man in his late 20s. I think he was about 29, 30 years old. And it had an impact on every aspect of it. This is a marketing job and needs to have problems traveling and trying to choose food products or food types, which kind of a thing. It's an international travel. Now, he was trying to do everything possible, so his bag was full of, things that he need to carry to manage his, IBS, that he has laxatives, he had to carry certain other products, and then he's always, mindful about it. And he's always stressed about this particular part, that how could I manage this day in, day out, and it's an impact. Then he was interested to look at, the alternate. He has been going to other methods, trying to get his colon cleansing done and look at if there any problem with it through a naturopathy or Ayurvedic treatments as such. He want to dig a little more about, what are the other probable reasons as such. So for this reason, I picked up a choose, because hypnotherapy is one of the beautiful methods to understand, reasons behind the disease as such, what could be causing this. So when we started digging deeper, then there's a lot of things got unveiled. The first session was something very beautiful, because he had a challenge, of choosing the program for his studies. There was a lot of constant pressure between the parents and his choices, that, what he had to choose out. when he had this impact on him, so he was suppressing it because out of loyalty, out of respect towards the parents, he just picked up whatever the parent chose for him. And this was suppressed in him, because this is going out and he is suppressing all these things. The brain is carrying that signal and then the gut is carrying it out as such. So he has been going through, not just from the childhood, even from the schooling, not just about the programs, right from the schooling, the way he wanted to be, the kind of choices that he had with respect to, being a sports. He was very interested in sports. The parents said, no, you cannot get into sports. You need to be very studious about learning, because you need to create certain, name for yourself in the society. You need to do this. So this kid, has been growing up with all this stress because you're not allowed to express it, you're not allowed to feel everything. You're suppressing it out from the childhood. So as it started passing out, we were regressing to different timelines. When we look at the childhood memory, then we looked at bringing it out with, with the teenage and the kind of choices that he had to go through, and right up to, even went up to the way where his marriage was an impact, because he had to choose a girl which are decided by the family, not by his choice. And that is when it was a huge hit for him, that he is unable to contain these emotions because he had a suppression and he was going through constant stress, that he is not allowed to be himself, and he is not allowed to be anything of that matter. So that's what is happening constantly. And we went through different sections of looking at not just on the releasing of the childhood trauma. We also worked on visualization techniques to allow him to understand the physiology, like how right from the consumption of the food, how you could with visualization it can help him to ease the pain, and find out if there are anything that is bothering him, because they're all energetic blocks. There is nothing in the gut which is causing this. There are basically emotional blocks, and these emotional blocks could be in sort of anything. It can be a tiny nail, or it could be in a form of a block there, or a blood particle in the sense, or it can be a black color object as such. So with constant continuous work on the hypnotherapy of visualization, he was releasing it out. So we could see considerable improvement stepping out, because he could understand what is the root cause of this. And he could manage, after I think about 4 to 5 sessions, he was in a very good space where he could manage IBS, and he was able to understand what are the thoughts and emotions that were bothering him. And when he got back his own voice, and when he could speak up for himself, because there is a suppression, now a new program needs to be done, which is to be about implementing is the new choices of expression, because he was slowly opening it up. And then we could see something remarkable changes coming in him. You could see that he was able to let go of this challenges that he was going through, and it helped him to choose whatever food products, because he was a foodie. He wanted to eat food. He was always having a challenge of choosing the right food types. Like he's always going to the menu, he's looking at I can't consume these things. Now he was able to enjoy, so that he was being more present for himself, that IBS was no longer bothering him, nor it was troubling him, nor it used to be like it used to be like any meeting he goes up, he used to tell us, he used to always tell I have an IBS. Like if they're calling out for a lunch or a dinner or a snack, he's always complaining. So he's become like his name associated by IBS, it used to be like it goes together. So he brought in the change, saying that okay, I don't need to talk about that. So he was able to understand where it was coming up. It was a beautiful process that the client took through, and then he worked through it diligently. It was a magical thing. And this is how we know that how emotions and how our thoughts, a power of thoughts and power of emotions, how it has an impact on our body symptoms and psychosomatic. That's why we talk about psychosomatic. Soma means it's there in the body, and whatever you think and feel feel the emotions in the body is very truthful to you. And it says, okay, buddy, I will do what is necessary. You're feeling it, I'll show it up to you as such. But connecting to that is very important. And of course, mental health is a very important aspect. And seeking help at the right time, working on it, and also taking care of your the kind of food that you consume. You need to be a balanced approach. That's what is. This case study was beautiful as such. It was a magical.
Very
Yes.
interesting. Very interesting. Okay, thank you for sharing. That was very interesting. If you have any questions, do ping us, DM us, and Jana and I will be happy to answer your questions. Thank you for this lovely discussion, Jana. We shall see our viewers again in another episode with another interesting topic. Signing off for today. Thank you. Bye-bye.
See, with more interesting subjects, I think we're going to come out with the next episode with very important and very common symptom too, where people carry this a tagline. I will talk about it later when we send you the intro or we send out the teaser for it. But for now, signing off, and keep following us on our Instagram page, and also the entire video will be uploaded on the YouTube link. We'll share you the YouTube link on the Instagram bio profile. So keep listening, sharing with people around you. Let us spread this awareness. Awareness brings in transformation. With this, I'm signing off right now. Bye bye, take care.